Hey everyone, a warm welcome to all my fellow pharmacy professionals out there. Today, we're going to dive into something really important, how we can take these big international standards of good pharmacy practice, or GPP, and translate them into the real, impactful work we do in our communities every single day. Okay, so here's our game plan. We'll kick things off by exploring the huge shift that's happening in our role as pharmacists. Then, we'll break down the 4 key pillars of GPP: managing our products, getting patient therapy just right, leveling up our own performance, and boosting public health. And finally, we'll pull it all together and see how we can put this into action. All right, let's jump right in. Our profession is going through a massive global transformation. Seriously, we're moving away from a time when we were just focused on the product, and we're stepping into a new era of patient-centered care. This isn't just a small tweak, it's fundamental to improving health outcomes and cementing our place as vital healthcare providers. This quote from the Order of Pharmacists of Lebanon just says it all, doesn't it? It perfectly captures this evolution. We're no longer just about the mechanics of dispensing. We're becoming true partners in patient care. And that idea? Well, that's the very foundation of good pharmacy practice. So what exactly is GPP? Well, it's way more than just a set of rules. Think of it as a globally recognized standard for excellence. It's backed by heavy hitters like the FIP and the WHO, and it gives us a framework to provide the absolute best, most evidence-based care for our patients. And the best part? It's not a rigid one-size-fits-all document. We see it adapted to fit local needs, like with the South African GPP guidelines, which makes it both a global standard and a practical local tool.
This slide really brings the whole idea home. It shows the massive mindset shift we're talking about. We're moving from a simple transaction, just handing over a product, to building a real collaborative partnership with our patients. It's about active counseling and monitoring to make sure they get the best possible results.
Okay, let's get into our first pillar. This is the absolute bedrock of our practice, right? It's all about guaranteeing the quality and safety of every single medicine that passes through our hands. This first role is our bread and butter. We're talking about the fundamentals, from making sure we purchase medicines from reputable sources to storing them under perfect conditions. It also means being meticulous about managing recalls and expired stock, and making sure waste is disposed of safely. These aren't just boxes to tick. They are promises we make that every product we dispense is safe and effective. Now let's make this real. This question right here is a daily reality for so many of us on the continent. So how do we apply those big GPP principles in a situation like this? How do we protect our patients and our products when the power goes out? And this is why GPP is so powerful. It's not just theory, it gives us a practical playbook. By consistently monitoring temperatures, having a solid backup plan, organizing our stock smartly, and even educating our patients on home storage, we can overcome these local challenges and maintain the highest quality standards.
All right, let's move on to the second role. This is where we step out from behind the counter and get right into patient-facing care. This is where we truly shine as the medication experts for our patients.
Effective counseling is where we save lives. It's not just about saying, take 2 of these with water. It's making sure patients know why they're taking a medicine, exactly how to use it, what common side effects to look out for, and what to do about them. This is the kind of information that empowers people and leads to genuinely better health.
Here's another scenario many of us know all too well. Just listing off facts isn't going to cut it. Our responsibility under GPP is to bridge those gaps, whether they're in language or literacy, to ensure our patient truly, genuinely understands. Patient safety depends on it.
And here is a total game changer for that, the teach-back method. It's so simple, but it is incredibly effective. Instead of us just talking at our patients, we turn counseling into a two-way street. We explain the key info, and then we ask them to explain it back to us. This instantly tells us what stuck and what didn't, so we can clarify until we're both confident they've got it.
Let's talk about the third role, which is all about us. It's about our personal and professional commitment to keep growing, keep learning, and keep pushing our profession forward.
GPP isn't a one-time certification you hang on the wall. It's a career-long commitment. It's about actively participating in continuing education, staying curious about new medicines and tech, and, this is huge, paying it forward by helping train the next generation. It's how we make sure we're always at the top of our game for our patients.
Now for our fourth role, and this is where our impact can become massive. It's about lifting our gaze from the individual patient to the health of our entire community.
Because we're on the front lines, we have this unique power to be incredible agents for public health.
Let's be honest, for many people, we are the most accessible healthcare professional around. That puts us in an amazing position to be true public health champions. We can lead health campaigns, provide essential screenings, and play a key role in everything from vaccinations to nutrition advice. Our impact goes far beyond the pharmacy doors. And this isn't just a nice idea, it's a real, measurable trend happening worldwide. A deep dive study that looked at 17 years of global pharmacy congresses uncovered a really fascinating shift in what our profession is focusing on. The data here is striking, isn't it? Discussions around professional development and public health are growing more than twice as fast as the traditional topics. This is a clear signal that shows us exactly where the future of our profession is heading. So, the million-dollar question. How do we bring all four of these essential roles together in our day-to-day work? Let's break it down into a simple, practical framework you can use. Think of these as the 4 pillars supporting everything you do. Be the guardian of quality, the patient's trusted expert, a lifelong learner, and a community health champion. It doesn't matter where you practice, embracing these 4 roles is the key to providing truly exceptional care and making a real difference.
So, I want to leave you with this one final thought. A challenge, really. This isn't about changing everything overnight. It's about taking one small, concrete step. What is one GPP principle you can champion in your practice this week? Maybe it's trying the teach-back method just once. Or maybe it's finally organizing that expired stock. What will your one thing be?